Hello, today I will be presenting my 2024 to 2025 Science Fair project, The Future of Lung Cancer Nanomedicine by Helli Chalishajar from Fairview School. My problem in question. My topic is based on the fact that lung cancer remains the leading cause of cancer deaths with poor prognosis and harsh treatments. Nanomedicine offers hope by enabling targeted drug delivery, boosting immune response, and improving early detection. So with this, some key questions arise. How can nanotechnology precisely target lung cancer? What impact does it have on treatment efficiency and patient outcomes? And lastly, what are the general and lung cancer specific pros and cons of nanomedicine? So my hypothesis. I hypothesize that if nanotechnology is applied to the treatment and early detection of lung cancer, it will significantly improve the precision and effectiveness of treatment while diminishing side effects. This approach will enable more targeted drug delivery directly to cancer cells, reducing harm to healthy tissues and improving treatment outcomes. Additionally, nanotechnology can be utilized for more accurate and earlier detection of lung cancer, allowing treatment to begin at an earlier, more treatable stage. The use of nanoparticles in a diagnostic imaging could enhance the detection of small, hard-to-identify tumors, increasing the chances of success, and as a result, patients may experience higher survival rates, fewer reoccurrences, and an overall improved quality of life. Overall, I believe that through further research and development, nanotechnology could revolutionize the way lung cancer is treated, making it a more personalized and effective approach for such a fatal disease. So, let's talk about nanomedicine. Firstly, to understand nanomedicine, it's important to first know what nanoparticles are. Their surface layer, consisting of ions and organic or inorganic molecules, play a vital role in their function. Designed for precise drug delivery, nanoparticles transport medication to tumor sites while minimizing harm to healthy tissues. They can also carry compounds that interact with tumor cell molecules. By customizing nanoparticles for specific applications, their effectiveness in cancer treatment is significantly enhanced. So with this information, what is nanomedicine? Nanomedicine uses nanoscale materials, so 1 to 100 nanometers, to diagnose, treat, and prevent diseases by enabling precise interventions at the molecular level. It targets diseased cells while preserving healthy tissues, reducing side effects, and enhancing treatment efficiency. In cancer therapy, nanoparticles deliver chemotherapy drugs directly to tumors, improving effectiveness while lowering toxicity. So how does nanomedicine work? Essentially, nanomedicine works by using nanoparticles to transport drugs to tumors. Since tumors have leaky blood vessels, standard chemotherapy can spread to healthy tissues. Nanoparticles, however, stay trapped in tumors and bind to specific markers on cancer cells. Once in the bloodstream, they circulate until they attach to the tumor, ensuring targeted drug delivery. After releasing the drug, they break down into harmless byproducts. Specifically, nanomedicine enables targeted drug delivery by engineering nanoparticles to transport drugs directly to specific cells, such as lung cancer cells. These nanoparticles are coated with molecules that bind to receptors on target cells, ensuring precise drug release while minimizing damage to healthy tissues and enhancing treatment effectiveness. Furthermore, nanoparticles also play a crucial role in early disease detection through various methods. Biomarkers like elevated proteins or circulating tumor DNA in lung cancer indicate disease presence. Functionalized nanoparticles such as gold nanoparticles and quantum dots bind to these biomarkers, amplifying detection signals using techniques like SIRS or fluorescence imaging. Moreover, enhanced imaging improves diagnosis by using nanoparticles like spions or gold nanorods, which assemble in diseased tissues, enhancing CT and MRI scans. Additionally, quantum dots functionalize with cancer-specific ligands, target and image cancer cells, emitting detectable signals for highly sensitive early cancer detection. Moving on, let's talk about lung cancer now. Lung cancer occurs when abnormal lung cells grow uncontrollably, forming tumors that impair lung function. These cancer cells can spread to the brain, liver, or bones. The primary cause is prolonged exposure to harmful substances, with smoking being the biggest risk factor. Other causes include genetics, radon gas, air pollution, and secondhand smoke. Moreover, lung cancer greatly affects the respiratory system by targeting the bronchi, bronchioles, and alveoli. Tumors in the bronchi block airflow, causing coughing, wheezing, and breathlessness. As cancer spreads, it damages the alveoli, reducing oxygen exchange and leading to fatigue. Inflammation, mucus buildup, and pleural effusion further restrict lung function. Next, I'm going to be talking about integrating nanomedicine into lung cancer. Firstly, inhalable nanomedicine. Inhalable nanomedicine for lung cancer is an innovative treatment for delivering therapeutic agents directly to the lungs using nanoparticles, improving drug delivery and reducing side effects. Its process involves nanoparticles being formulated to encapsulate chemotherapy drugs with specific properties like size, surface charge, and hydrophobicity for effective delivery. The formulation is converted into an aerosol for inhalation through nebulizers or inhalers. Once inhaled, nanoparticles travel through the respiratory tract, targeting lung cancer cells. They then release the drug in a controlled manner, maximizing its effect on tumors while reducing harm to healthy tissues. Now, what are some current nanomedicine approaches for lung cancer treatments? Well, currently researchers are utilizing nanoparticle technology to create targeted lung cancer treatments that minimize toxicity and improve effectiveness. A key focus is the vascular endothelial growth factor and VEGFR signaling pathway, which promotes tumor growth, angiogenesis, and metastasis by regulating vascular permeability and cell survival. Furthermore, nanomedicine explores lipid-based, polymeric, and inorganic nanoparticles to deliver drugs directly to cancer cells, offering a more precise and effective approach than traditional chemotherapy. Continuing on with this, a Phase 3 clinical trial evaluated whether nab-paclitaxel was as effective as docetaxel in patients with advanced non-small cell lung cancer who had already undergone previous treatments. The study was designed to test whether nab-paclitaxel was non-inferior, meaning it was at least as good as docetaxel in treating lung cancer. The trial found that nab-paclitaxel was just as effective as docetaxel in terms of overall survival, progression-free survival, and overall response rate. This means that both treatments allowed patients to live for similar lengths of time and had comparable success in controlling cancer growth. One key finding of the study was that nab-paclitaxel had a better safety profile than docetaxel. Patients who received docetaxel often experienced severe side effects such as neutropenia, a dangerous drop in white blood cells, and febrile neutropenia, a condition where low white blood cells cause fever and infections. In contrast, nab-paclitaxel caused fewer of these serious side effects, making it a safer and potentially more tolerable treatment option for patients who had already been through chemotherapy. This study is significant because it suggests that nanomedicine-based treatments may be a better option for lung cancer patients who need second-line therapy. Finally, combining nanomedicine with conventional treatments can greatly enhance effectiveness. In surgery, nanoparticles improve outcomes through preoperative imaging and intraoperative tumor detection. With radiation therapy, they enhance radiosensitization and enable targeted delivery of radiosensitizers. And last but not least, in chemotherapy, nanoparticles improve drug delivery and help overcome drug resistance, making treatment more precise and efficient. Now let's move on to some general information about nanomedicine for lung cancer treatments. Firstly, the cost of nanomedicine. Since nanomedicine for lung cancer is still in the research and development phase, specific cost data is limited. However, compared to traditional treatments, nanomedicine therapies are significantly more expensive. This high cost makes them inaccessible to many, especially since approximately 75% of the global population lives in developing or underdeveloped countries. Next, the pros versus cons of nanomedicine for lung cancer. As we learned, there are many advantages of nanomedicine, such as it enhances drug delivery by improving bioavailability, enhances controlled release, and overcomes drug resistance while minimizing side effects. It also aids in early detection, advanced imaging, and combination therapies, with the potential to enhance immunotherapy and transport drugs more effectively across biological barriers. However, there are also challenges to overcome, like potential toxicity, complex manufacturing, regulatory hurdles, limited clinical data, immune reactions, and high costs. Finally, from all this information, we've reached my conclusion. I believe nanomedicine offers a transformative approach to lung cancer treatment, providing improved precision, targeted drug delivery, and reduced side effects when compared to traditional therapies. By utilizing nanoparticles, drugs can be delivered directly to cancerous tissues, allowing for more effective treatment while minimizing harm to healthy cells. This targeted approach not only reduces toxicity, but also greatly enhances patient outcomes. Furthermore, nanotechnology has the potential to advance early detection methods, enabling the identification of lung cancer at more treatable stages, which can increase survival rates and reduce the risk of reoccurrence. Despite the promising benefits of nanomedicine, its implementation comes with several challenges. Long-term toxicity, immune responses, and potential environmental impacts are among the concerns that require thorough research and regulation. Additionally, the high cost of nanomedicine raises ethical questions of accessibility, as advanced treatments must be made available to a broader population rather than being limited to individuals. Overcoming these barriers is crucial to ensuring nanomedicine's widespread adoption in healthcare. In conclusion, as research progresses, nanomedicine is likely to revolutionize lung cancer treatment. Its potential extends beyond lung cancer, offering hope for treating other diseases with high precision and effectiveness. Although challenges remain, continued advancements in nanotechnology may usher in a new era in cancer care, ultimately improving patient survival rates and overall quality of life. That's the end of my presentation. Thank you for listening, and I hope you enjoyed it.